Mr. Williams. My name is Stacy. I'm going to be your nurse today. How are you?
I'm good.
Okay, so I'm just going to do some trach sectioning today and clean around your trach and change your inner cannula. Is that okay? All right, before we get started, I want to make sure that the oxygen is working. I want to make sure that the suction machine is working, so I'm going to go ahead and turn it on. And it's to the proper setting between 80 and 120. Right now it's like at 100 millimeters per mercury, so that is perfect. Can I go ahead and have you verify your name and birthday?
June 18, 1967.
And can I just verify that against your armband? Okay, perfect. Just want to make sure you're at a 45-degree angle. Just go ahead and put on my gloves. I'm just going to listen to your lung sounds. And for the purpose of this video, I'm just going to listen to your lung sounds over your clothes. If we were in a hospital setting, it would be against your skin. Just have you take a big breath in and let it out. Thank you, Mr. Williams. Now I'm just going to put this across your chest. I'm going to open the trach kit. I'll just throw these away. And I'm going to go ahead and pour my normal saline into the basin. And now I'm going to go ahead and put on my sterile gloves. And since the trach kit is already open, I can go ahead and put the items inside the trach kit. So with my dominant hand, I will take the suction tubing and go ahead and wrap it around my dominant hand. And then with my non-dominant hand, I will take the suction tubing and attach it to the end of this. This now makes the end of this in my hand non-sterile. We'll go ahead and dip this in and make sure that the suction is working, and it is. So I would just take this and put it down into the trach until I hit resistance, then I would pull back. We'll go ahead and apply intermittent suctioning by twisting and pulling the tube out. And if I knew that he had a lot of secretions in there, I could go ahead and rinse the catheter and do another pass down into the trach. And then I could go ahead and take off my gloves and wash my hands, and then that part would be done. Now, at this point, if I wanted to do trach care kit, I could go ahead and, for the purpose of this video, we'll pretend like these are clean gloves instead of sterile gloves. I could move his dressing out, and I could go ahead and open my trach cleaning kit, and I could put on a glove on my dominant hand, and to gather the supplies and put them accordingly on my workstation. With my non-dominant hand, I could take my supplies of hydrogen peroxide and sterile water and prepare my solutions. And one container would be the hydrogen peroxide, the second container would be sterile water, and the third would be also the sterile water. I could go ahead and pull Mr. Williams' inner cannula out and drop it into the hydrogen peroxide. I could then, but before I do that, I would go ahead and don on my other glove, and I would have a pair of sterile gloves. So then I could go ahead and take his, with my glove, I could go ahead and take out his inner cannula, put in to the hydrogen peroxide. Since I already have a sterile field, I could take the brush and go ahead and clean the inside of the cannula. I could take the cannula, then drop it into the first thing of sterile water and rinse it out. I could then take the pipe, take it out and take the pipe cleaner and go through it only one time and drop it. Go through the second one, go through and drop it. And then I could take my third one and I could go ahead and dry it out. I could take the third one and dry the inner cannula. And then I could go ahead and replace the inner cannula. I could then take a sterile Q-tip in my third container and put it in there. And I could clean around the stoma from the inside out and then drop it. Do the same thing, wet it, and go around the stoma and clean around the edges. I could then take go ahead and take the fenestrated gauze pad and put under the trach collar and then pull up as needed, and then that would be clean. If I needed to, I could always use these clean trach ties, or I could just use another trach collar and replace this trach collar. I would then take off my gloves. I would go ahead and wash my hands. I will make sure that the bed is at the correct position, make sure all the bed rails are up. Mr. Williams, do you need anything else? Okay, so I have your call light, I have your phone right here. There's no cords or anything anywhere. If you need anything, just go ahead and hit the call light, okay?